So, welcome, Niraj, and thank you for your willingness to share your journey learning, using, and applying the reset approach. But first of all, tell me a little bit about yourself. Who are you? Where are you? What are you doing?
Yeah, my name is Niraj Shah. I'm from India. I'm located in Srirampur. It's near Shirdi in Ahmednagar district. Past 2 years, I have been practicing chiropractic and cupping therapy, ISTM, completely into holistic healing.
But you're also a physiotherapist, right?
Yeah.
Okay, so when did you learn the reset approach?
Last year in November, I guess you had a hands-on training for 4 days in Chennai. Yeah.
Okay.
That was when I got enrolled myself.
Yeah. So just like Somi, you were part of the Chennai group, which was in the early November in 2023. And now we are about 5-6 months later. What were your first impressions about the course?
My first impression was actually I've been following you from past 1 year on your Insta page, and that then I got enrolled myself for Chennai course, and my first impression was a bit from past 2 years I have been practicing, and I have come to conclusion for me pain is 30% physical and 70% psychological.
Okay.
Yeah, because people from many years they suffer from back pain, shoulder pain, knee pain, any sort of musculoskeletal pain or even visceral pain. What they do is they just go to a allopathy doctor and consume medicines for over a period of time, and they are not treating the root cause. They are treating the symptoms only. Yeah. Treatment are of two sorts. One we treat the pain and one we treat the root cause.
Yeah, and so what do you mean by psychological problems that are leading to musculoskeletal pain or any other pain in the body?
See, what happens is if you are suffering from backache, patient nowadays cervical and backache are a universal problem. Now what they do is they are suffering from many years. What they do, they go to their family physician or orthopedic doctor or MD medicine, and what they do, they put them on a prescribe them painkillers and some multivitamins. So what happens is till the time they are consuming the medicine, they feel relaxed. The pain factor is reduced. But as soon as that course gets over, the pain increases each and every time. So what they do, then they consult neurosurgeon, neurophysician. They go for MRI, X-ray, CT scan, and the same thing. The last thing they are advised that now you'll have to go for a surgery. So what happens is that psychologically it's hampered, that they think that they are suffering from a problem which is not getting diagnosed. They are, after having consulting each and every person related to that pain, the only last option they are having is that surgery. So it's gets psychologically stuck in their mind that no, I have something which cannot be cured.
Yeah, and what we're seeing is there is a shift also from the back pain stemming from physical trauma, but that is rare cases these days. Most people, depending on your demographics, is that the pain doesn't stem from a physical trauma, but stems from what I've been calling the biological footprint, that stress, the increase in the demands on us compared to the resources, that there is a conflict between the demands and the resources, and that stress response becomes more agitated, always further and further and further it goes into that tension, and because a stress response is always associated with muscular tension, increase in heart rate, increase in breath rate, changes in vascularization in body and brain, and also then digestion goes down at one stage, and immunity. And that a lot of these back pains or neck, shoulder, back pains are today related, not to the physical trauma, as I said, but then more to this over tension that is created through stress, right? And then it becomes a vicious circle in the sense of, oh, these pills, if I stop them, then they're, it just comes back. Or with any kind of classical physiotherapy, it doesn't seem to be a go away. In the classes, I always ask this, do the classical techniques, those that you've been using, for all this time, are they still as effective? And many of the participants in the courses say no, because those were developed in the 19th and 20th century for very different conditions that led to the pain, and more direct. So more the physical trauma, which is a trauma directly onto a muscle or onto an articulation. Today, it's indirect with the intermediate of the autonomic nervous system. So did it then help you coming to this course? And it's only a 4-day course that you went to. And is that enough for being able to then practice it and make a difference in these patients you have?
Yeah, it's completely working. And in 4 days, as on the first day, when you had some theory part, you told us that when we end on the fourth day, you will not be confused that what was taught on first day or second day or first day afternoon session or evening session. Started our theory part in the first session in the morning. We all were like confused that how we could grasp all things in 4 days, everything. But you made us sure that you need not to worry. You concentrate on your hands-on training, what we'll be doing, and every reset approach will be followed by previous reset approach done.
Yeah.
So on the first day, what we did in the first session, in the second session, when we started second session, we got revised for the first session. Then again in the evening for third session, we got revised for first session, second session, and third session. So it was continuously hammering us. That process was completely, so we could not forget it. That we were not getting blank. That, oh, what was taught in the first? What was the position of the hand? What was the position for a skull, or the points you taught? It was very informative and very easy. And then on the fourth, same thing repeated. When we started second day, what we do it is, we started from day one, session first, session two, session three, and then second day, session one. So like this, it was practice makes man perfect.
Yeah, this is the difference, and that what you learn on the first day, you will repeat every time again and again. So everything is built up, but we always go back to step one before we go into step two. And we build on step three, but before you do that, you have to do step one, step two, and every day is like that. So as soon as you reach then the fourth day, you've done it so many times that you lose nothing on the last day. And as soon as you go back to your practice, that there is confidence. And I also see that some of you, they're just practicing it, in the evening of the first day, they're already applying it, and with confidence. And on the fourth day, we sometimes have some time before I go to the airport, and then some people are around, and I say, hey, okay, do it on me. I've been teaching, and I could use a bit of a reset. And without any problems, they're doing it on me. And I think this is the key. Yeah. So tell me a little bit about putting it into practice, right? You came back on the fourth day to your practice, and then you started using it. How easy or how difficult was that?
No, it was very easy for me because the amount of practice we got. So we had almost 35, 36 participants. So uh, we had 36 patients. So where I for practice, I did 36 patients in 4 days.
Yes.
So that is a hell lot of practical demonstration of what we are learning. Even on the second day itself, I did reset approach on our cameraman, and he was shooting our videos,
Yes.
and he was very stressed and exhausted. So I did it on him, and within 5 minutes, he was like very relaxed and calming, and he said, "I have not felt this from past 2 months."
Yeah.
The feeling which he
It
was
was
having.
wonderful to see that. Yeah.
Yeah.
And so, do you use it as a chiropractor or do you use it as a physio?
No, I use it as a chiropractor or any modality I do. See, what I do is when patients comes to me, first is assessment, history taking, counseling, and then before starting any treatment, whether it is chiropractic or cupping or ISTM, I would do a complete reset approach onto the patient. Uh, I remember you told me, you told us one thing is test, treat, and retest.
Yes.
So uh, I perform the reset approach. I see where if patient is having some shoulder problem, I will just assess with reset approach full body. Then I will do whatever modality I am using, whether it may be chiropractic manipulations or some osteopathic articulation techniques or cupping or ISTM. And then again, after my modality has been used, again I will do the reset approach. At that time, I will educate my patient. See, before when I tested, this was the motion where I was feeling barrier or there was some problem. Now after that, I did this manipulation, I did cupping, I did ISTM, and now again when I am assessing, I feel there is 70 to 80% improvement in the barrier or range of motion was restricted. It's now a bit open, and this is how then patient I make my patient positive. From negative thought of mind, I make him positive. He thinks, no, he has done something before treating me, he did something like this. This is patient's point of view. We know what we are doing, but
Yes.
patient is thinking psychologically. Before treating me, he did me something like this. He from my head to toe. Then he treated me with manipulations, cupping, and now again he's retesting it, and now he's saying that I was feeling bit restrictions over here. Now it's coming more easily. So there is something logic in that. So then
Yes.
patients, he will also himself will say, yes, I am feeling a bit relaxed now. So that is I use because I know it is working, but in patient's perspective, I am making him from negative thought of mind, I am converting him to positive thought of mind.
Okay.
It's very
Yeah.
helpful for me.
I think you integrated it beautifully. It's like a pre-treatment and a post-treatment.
Yeah,
So you have
yeah,
the reset approach is a pre-treatment, a full body pre-treatment approach that starts with the head to calm that autonomic nervous system, then to alleviate all the overcompensations that have been created, the tension that is in that body. And then once that's done, once that first round, full body round is done, then you're going to look at the symptom of the patient and going to correct that with the tools that you have. As you said, for you, it's like can be chiropractic or cupping. And then at the end, just do a quick round around the body again, because sometimes that treatment itself can provoke a little bit of stress again, a bit of pain, and then we calm it all down. And beautifully also to show the patient, look at it now, look how this has changed, feel your body, feel how you're relaxed you are, and feel that kind of stretching that you have, or that malleability that you have, so that they, oh yeah, that is really changed. And because that's also very important for that emotional, psychological aspect of the treatment. And Niraj, how long does a treatment take for you per patient?
Per patient, half an hour, 45 minutes.
So all of that in half an hour to 45 minutes, right? And the results of that is that the patient results, have you seen a change in that since you've been using the reset approach?
Yeah, yeah. Before, the first foremost change I saw is before reset approach, after doing any modality, whether it may be chiropractic, osteopathic, articulation, cupping, ISTM, after treatment, patient was like, when I used to ask him, now you check your symptoms, he was like, no, I still have the same pain, it's only 5-10% relief I am getting. But after reset approach, pre treatment and post treatment, the feedback from patient is almost 80 to 90% positive.
Wow.
Because as I told you, I am playing with his psychology.
Yeah.
Before assessment, then treatment, and again reassessment. So at that time, I'm educate my patient. See, here there was a problem over here. There was range of motion restrictions over here. So I did this. I performed this, and now again I am reassessing, and I am feeling it's almost 60-70% better than previous. So
Yeah.
patient also gives me positive feedback for that. And then he will also think, nah, yeah, he's saying something. So
but also it increases your reputation, right?
yeah,
As as
yeah,
when you are able to make a better change within one session
yeah,
already, that gives you the reputation, that gives you also more patience, because of you are then that person in your community that is different and making it really work. Even though that some people think this, I cannot be helped because I've been to X Y Z, the doctors don't know what to do with me, and there is Niraj, and he's able to solve it. I see that also in my practice, how people are desperate for help, and they don't find it anywhere else, and then suddenly within the hour, so treatment itself is about 30 minutes these days, that there is a difference, significant difference. They from, okay, this can be healed. Wow. For physiotherapists, I've never been a physiotherapist myself. So for physiotherapists who have shorter time, 25 minutes, for example, what would you suggest for them, how to use the reset approach?
as I told, these 5 to 7 minutes are enough for pre-treatment. Then you do all your modalities, whatever you're doing, yeah, IFT, TENS or traction or any mobilization, manual therapy for 15 minutes. And again, after 5-7 minutes, you do the reset approach.
Okay.
You can manage. Yeah. Before I used to, one more change. Before I used to call patient for at least 5 to 6 sittings, but after applying reset approach, I only call patient for 3 to 4 sittings, and that too with the gap of 2 to 3 to 4 days.
Okay. Wow.
Yeah,
So, reducing patient recovery, which is
yeah,
our prerogative at the end of the day. Our prerogative is to help our patients in the fastest possible way to be autonomous and to be back into health. And some people think that, but of course, financially, I need more, I need this 5-6 times to to have enough finances, but this is not our job, right? Our job is to heal people, and the faster you heal people, the more people you get. So at the end of the day, you are better off by being the best and by helping people the fastest. So another question I have for you, Niraj, is how would you, in your own words, describe the reset approach? What is it for you?
For me, it's a magic. In one word, if you would like to describe why I called it magic, because uh, within 10 minutes, the person who is suffering from stress, anxiety, depression, hasn't slept well for many months, and within 5 minutes when we do reset approach and he's snoring.
Yeah.
So
Remember in the class that first time, so the first time you touched and suddenly the whole, it was on the first day, within nearly the first hour, and the first time you are touching, everyone was snoring. And it was so beautiful to see that it was just not one person, it's suddenly the whole room, everybody on the table was snoring away, and just like everybody was looking for what just happened. Yeah, I thought it was a fantastic moment. And indeed, it's that one that I'm still, and I'm looking around. Yeah, I think it is one of the only ones where that stress response is so quickly brought back into ease. All right, the reset approach is an acronym for the return to ease, where that physical stress response is really calming down, and that is the essence of the reset approach, but also the essence of healing. You cannot heal in stress, right? If your stress response is active, you cannot recuperate and regenerate, because that's only done while the body is at ease. So it's so important that we start to understand that, and that more and more physiotherapists, manual therapists in general, start to understand that why we do the reset approach first. Well, to prepare the body so that healing can happen, and when you do the manipulations or you do any kind of treatment, that it is done on the condition that the body can accept it, and of course heal itself. And that also more and more medical doctors should start to understand that these multimodal problems that people come with today, that most of its origin is stress-related dysautonomia, and that is the official term for it. And for us, I say that the dysautonomia is created to the autonomic lesion, and that is when the body goes into the sympathetic mode more than into parasympathetic mode. Okay, now give me, if you can, a patient example. Share a specific example where you use the reset approach and where the patient's recovery or well-being was improved.
I had one patient as soon as I came back from Chennai. I had one lady, she is a teacher, and she had a disc bulge, L4, L5S1, and cervical spondylosis also, and she had some constipation problem also. But it was from past 4 to 5 years. She had been to orthopedic, neurosurgeon, neurophysician, and after some time she was put on to antidepressants. So when after coming back from Chennai, uh, I did a reset approach on her, and I requested her that please don't take your sleeping pills for 2-3 days. Let me observe what do you feel. And the same day at night, without taking sleeping pills, she slept very peacefully. And the next day morning she called me up and she told me that I'm very much thankful to you, because without sleeping for me was impossible. But after what she said, whatever you have done me to yesterday, it was very different feeling for me. How can this happen? You didn't give me any medicine, only just by touching my skull, my brain, each and every part of my body, whatever you did. She didn't know what I was doing. So she was explaining it in her own words.
Yes.
So she said, how is it possible? I visited one of means the best neurosurgeon and neurophysician, but this relief I didn't feel anywhere. Her constipation was also decreased in 2 3 sittings after that. Yeah.
Yeah. Because that
Maybe
autonomic
we yeah,
nervous system leading to changes in vascularization of
vascular,
our
yeah.
TGI, also the vagus nerve that is then
Vagus nerve,
inhibited,
yeah.
and so that the peristaltis is decreased. So by releasing that stress response, by bringing autonomic balance, then it has an effect also onto the digestive tract. And some people, constipation just disappeared after a couple of days. It's an amazing tool that can be introduced very quickly and very effectively, as you say. As soon as you get back from the course into your practice, you can do it from A to Z. So what would you give as advice to physiotherapists, osteopaths, and manual therapists in general who don't know about the reset approach? Would you recommend it? And
No, I will highly recommend it, because as I told, pain is 70% psychological and 30% physical. So we need to make our patients realize that whatever we have done with him or her, there is certain of improvement. But see, as allopathic doctors and orthopedic surgeons, we don't have any written proof of MRI, CT scan, X-rays, these things, right? So with research approach, at least we can educate our patients that before this was the situation with your body, and now after my modality, again when I have reassessed, now this is the situation, whatever
yes,
may be, from head to toe.
yeah. So to clarify that, so the reset approach is a manual approach that is being practiced, but you get a lot of information about why this manual approach is working, and also on the conditions of the health problems of the 21st century. And so where does these problems of today come from? And why does the reset approach help with these specific new conditions that have been created? And this is then the information that you also share with your patients to say okay, your problem stems from this, right? And doctors have not been able to give them that because they have not been trained in this. They have not been, they don't have that perspective, that new perspective that is so important, because we've entered into this 20th century and suddenly the world changed and we had COVID, and more people are suffering from the demands and less resources. More and more is asked from us, but the resources that we have to reset ourselves are diminishing, because that the whole stress ease response, it's prehistoric. It hasn't had an update. It's not evolving as fast as our environment, and it's suffering. It is conflict between biology and culture that I stress in my classes. This is this huge issue that is leading to autonomic lesion. The autonomic lesion is leading to the dysautonomia, and then the symptoms of that are then the various musculoskeletal problems, digestive problems, depression, anxiety, also the brain fog, like in long COVID, can be all brought back to that issue that the autonomic nervous system is imbalanced, and through manual therapy with the reset approach, you can reset it there is no medication for it. There is no electrostimulation to do this. It can only be done at this moment through hands and through a full body treatment because it involves the whole body. Anyway, Niraj, is there anything else you want to add to this conversation? Because we need to end it because of the time constraints that we have.
One thing I would like to add is that I would request everyone who are into manual practice, not only physiotherapists, chiropractic, osteopath. I would request even surgeons also to get trained for a reset approach, because pre-surgery, post-surgery, if we perform reset approach, there would be a lot of calming effect on the patient. The fear, anxiety, it would be very helpful if they perform this reset approach on the patient who is going for kidney transplant or any kind of surgery. It would be
Yes.
very benefited for them.
I completely agree. I am completely pre-post-surgery reset approach does miracles for people that have just been diagnosed with cancer, or like, please come and visit a reset approach practitioners like Niraj, because it's so important that we reduce that stress so that the healing or the treatments are improved. Anyway, Niraj, I thank you very much.